Hi everyone, welcome back to my channel. My name is Dr. Chen and I am a counseling psychologist. I have been in training and practice of psychotherapy for the last 18 years. This is my 3-step tutorial to finding your next therapist. Step 1, check your mindset. Step 2, know the basics. And step 3, interview your therapists. Alright, step 1, check your mindset. For better or for worse, therapists tend to be either idolized or devalued. In reality, therapists are just normal, fallible human beings. And what you're looking for is a good enough fit. Trust me, they don't have to be perfect. Neither do you. Everyone has something to teach you. And once you let go of the burden of perfectionism, the next step is to take stock on your current beliefs about psychotherapy. For example, do you think it's fluff? Do you believe that smart, self-sufficient people should never need extra help? Do you think you're too broken that no one could ever fix you? Are you approaching therapy with openness, humility, and curiosity? Or are you approaching it with guardedness, doubt, and embarrassment? There is really no good or bad feelings, but just be aware that any of these preconceptions, feelings, or beliefs are going to have a pretty direct impact on your therapeutic relationship. Step 2, learn the basics. Because the process of finding a therapist takes time and it can be a somewhat complex process, you really want to be looking when you're not already in dire need. If you have family members, friends, or coworkers who are already in therapy, ask them how they found their therapist and how their experiences have been. You can also read some articles online or watch some YouTube videos, just so you can learn the basics of the psychotherapy lingo. If you don't have time to read these articles or watch YouTube videos, here is my 3-minute high-level overview of the bare minimum you should know. First of all, in the US, various types of mental health professionals can practice psychotherapy. For example, psychiatrists, so MDs, psychologists, so PhDs and PsyDs, licensed clinical social workers, so LICSWs and LCS, licensed professional counselors, LPCs and LMHCs, and licensed marriage and family therapists, LMFTs. These are all different types of credentials that can practice psychotherapy. And you really want to be looking for these credentials when you're doing an online search. Second, there are different types of psychotherapies, and they can be loosely put into 2 big camps. One is behavioral therapies, and the other is insight therapies. While behavior therapy tend to focus on directly changing undesirable thoughts and behaviors, insight therapy tend to focus on addressing the internal, often unconscious root cause of mental health symptoms. Third, one of the most affordable ways to pay for therapy is to look for an in-network provider who is credentialed with your insurance. So all you have to worry about is to pay for your deductibles and co-pays, and the insurance company will pick up the rest of the bill. Last but not the least, there are many ways you can find a prospective therapist. For example, I like to use the Psychology Today website when I'm looking for a therapist for myself or looking for referrals for my patients. You can also call your insurance company or use their online directory to look for therapists. Last but not the least, you can talk to your PCP and ask for a couple referrals. Step 3, interview your therapists. The therapy process is really a prolonged mutual assessment of fit. Once you have your 2 or 3 referral, start by giving these therapists a call and set up a free 10 to 15-minute consultation, which is offered by most therapists. And here are some questions you can ask your prospective therapist during your free consultation. Are you taking on new patients? Do you take my insurance? How much should I expect to pay for each session? Do you have experience in treating my types of concerns? What is your approach to therapy work? Treat the consultation process as a mutual evaluation of fit. You're looking for someone who seems trustworthy, reliable, warm, and competent. In the meantime, you're also doing an internal check. How do you feel talking to this person within the 10-15 minutes? Do you feel safe? Do you think you can open up? Would you like to come back and talk more with this person? All of these internal processes are important. If you sense through these free consults that there isn't really a good fit between you and the therapist, don't overthink, just move on. There are many qualified therapists out there, and you really shouldn't be stuck with someone who you clearly don't vibe with. In fact, I would say the same thing for the entire therapy process. If at any point of therapy you feel like you hit a wall, you don't know what you're working on, you're not looking forward to therapy, you should talk directly with your therapist about your concern. Therapists cannot read your mind. It is very important for you to be directly communicative with your therapist about your needs. And if you are convinced that there really isn't a fit, I would say the same thing. Don't overthink it. Just politely ask to pause the session and move on. In talking with my colleagues and friends, I learned that it really is the norm rather than the exception that a person would have to work with a couple different therapists and perhaps being switched a couple times before they know who will be a good fit for them. Again, there is a learning curve of understanding what fit looks like, understanding how to use therapy, and making it work for you. To sum up, to find your ideal therapist, you want to check your mindset, you want to learn the basics, and you really want to interview your therapist.